Knee arthritis? Say goodbye to the pain the easiest way. Proven. What if the easiest way to permanently stop your bone-on-bone knee pain isn't surgery or pills, but a simple 3-step muscle balancing trick? Almost everyone who has ever suffered from joint wear and tear knows the absolute frustration of waking up with stiff, aching knees, or feeling a sharp, burning pain every single time they try to walk down a flight of stairs. In my years of clinical practice as a physical medicine specialist, I have had countless patients sit in my office, visibly exhausted, asking how to fix knee pain without relying on constant anti-inflammatory medications that only irritate their stomachs. Today, we are going to look past the temporary brace aisle and get straight to the biological root of what is actually happening inside your joints. We are going to explore the physiological mechanisms behind joint wear, look at the absolute best exercises for knee pain, and outline my clinical protocol. Knee arthritis? Say goodbye to the pain the easiest way. Proven. If you are tired of feeling limited, stiff, and held back by your joints, you are in the exact right place. Hello, and welcome. I'm Dr. Matthew Harrison. On this channel, we break down complex medical topics into simple, actionable daily wellness steps so you can live a healthier, happier life. If you believe that maintaining your physical mobility is the absolute cornerstone of a vibrant, independent life, please take a quick moment to subscribe to our channel and hit that notification bell. By joining our community today, you ensure that you never miss a vital medical guide, while helping us share these essential wellness resources with millions of others who are silently searching for reliable, pill-free answers. To understand why target exercises and stretching are so effective, we first have to demystify what knee osteoarthritis actually is and look at why your joints are hurting in the first place. Your knee is a beautiful, load-bearing hinge joint. The ends of your thigh bone and shin bone are coated in a slippery, protective layer of cartilage, which acts as a natural shock absorber, allowing the bones to glide smoothly over each other. However, due to age, repetitive stress, or muscle imbalances, this cartilage can slowly begin to wear down. When this happens, the joint space narrows, and the underlying bones can begin to rub against one another, causing inflammation, bone spurs, and severe arthritis knee pain. A highly common area where patients experience this is the inner knee pain, which is the medial compartment of the joint. Because our walking gait naturally puts more pressure on the inside of the leg, a lack of muscle support can cause the inner cartilage to wear down much faster. When this happens, your body's natural reaction is to stiffen the surrounding muscles to protect the joint, which unfortunately increases your stiffness and makes your knee pain significantly worse. If you have ever had your travel plans, exercise routine, or simple daily walks completely disrupted by this painful joint stiffness, please take a quick second to hit that like button to support our channel. If you feel comfortable, please drop a comment below and share where your knee hurts the most, whether it is the inner knee, directly under the kneecap, or behind the joint, or ask any questions you have about managing your joint health. Also, if you know a friend or family member who is constantly complaining of knee pain and stiffness, please share this video with them. Spreading health and wellness education is a collective effort, and your simple share could help someone take their first pain-free step today. Now, let us discuss the practical, actionable ways to manage this issue, starting with how to relieve knee pain using my structured, 3-step joint stabilization routine. When searching for an effective knee pain treatment, many people make the mistake of completely resting the joint. However, as medical professionals, we know that motion is lotion. Resting too much makes the joint stiffer and weakens the supporting muscles, which actually increases the bone-on-bone friction. To break this cycle, our first step focuses on knee pain relief exercises that strengthen the primary stabilizer of your knee, the quadriceps muscle on the front of your thigh. A classic and highly safe exercise is the quad set. Sit on a firm surface with your legs straight out in front of you. Place a small, rolled-up towel directly under your knee. Gently tighten your thigh muscle, pressing the back of your knee down into the towel. Hold this contraction for 5 seconds, then release. Perform 3 sets of 10 repetitions on each leg. This simple isometric contraction builds quad strength without grinding or compressing the cartilage inside the joint. Our second step involves gentle, targeted knee osteoarthritis exercises designed to build hip and glute strength, which directly controls the alignment of your knee. A fantastic exercise is the straight leg raise. Lay flat on your back, bend one knee with your foot flat on the floor, and keep the painful leg straight. Slowly lift the straight leg about 12 inches off the floor, keeping your thigh muscle tight. Hold for 2 seconds, then lower it slowly. This exercise builds strength in your hip flexors and quads without putting any compressive force on your knee joint, making it an incredibly safe and proven choice for managing arthritis knee pain. Our third step focuses on physical decompression through stretches for knee pain. When the muscles in the back of your leg, specifically your hamstrings and calves, are chronically tight, they act like a tight rubber band, pulling the joint together and increasing the bone-on-bone friction. To relieve this tension, we utilize targeted knee pain stretches. A simple calf stretch against a wall or a gentle seated hamstring stretch can instantly relieve the pressure on your joint. Sit on the edge of a chair, extend your painful leg straight out with your heel on the floor, and gently lean forward from your hips until you feel a comfortable stretch in the back of your thigh. Hold this position for 30 seconds, breathing deeply. Incorporating these simple knee pain exercises and stretches into your daily routine is one of the easiest, most proven ways to keep your joints moving smoothly. While these home strategies and target movements produce outstanding results, it is important as a medical professional to discuss when you should seek a comprehensive clinical evaluation. If you have followed this routine and your joint continues to swell, becomes hot to the touch, or if your knee physically locks or gives out when you try to walk, these are red flag symptoms. These signs can sometimes indicate a severe meniscus tear or a localized infection and require immediate medical attention. From a clinical perspective, a doctor can safely evaluate your symptoms and recommend a personalized knee pain treatment, which may include physical therapy, safe joint lubricating injections, or regenerative therapies to restore your mobility. As we look at the big picture of your health, please remember that your joints are dynamic, living structures that react deeply to how you move and care for your body. Knee arthritis is not a mandatory consequence of aging. It is a highly treatable signal that your joint needs better support and alignment. By understanding the underlying biology of your knee, stabilizing your muscles, practicing gentle stretches, and keeping your joints active, you can easily say goodbye to the pain and enjoy a life of active, pain-free mobility. If this guide has helped you understand the biology of your joints and has given you a clear, actionable plan to relieve knee pain naturally, please support our mission by subscribing to the channel and hitting that like button. Don't forget to leave a comment sharing your progress, and share this vital joint health tips video with your family and friends. Your engagement helps us continue to provide high-quality, evidence-based medical advice to families around the globe. Thank you so much for watching. I'm Dr. Matthew Harrison. Take care of your body, be kind to your mind, and I will see you in our next video.